When you become a Rogers volunteer, it's always an opportunity for everybody to come together and try different things that they've never been able to do before.
What I've learned here is different skills that I thought I would never even be interested in learning.
By being here at Rogers, I can learn all these different things that will help me be stronger.
Working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team.
They're people from our community, so they know and they have a heart for our community to step outside of our comfort zone and do more.
Don't be afraid, because this is where you're going to gain the most valuable experience that you can use in your future.
I encourage everybody to be a volunteer at Rogers TV because not only do you grow professionally, you grow personally as well.
This is Rogers TV, New Brunswick.
It was my daughter's birthday. She was blowing out the candles on her cake when we heard coming from the TV. So we stopped and listened, and it helped us get to safety. That's why when I think of my daughter's birthday, because now she gets to keep having them.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
This is Rogers TV, Fredericton.
Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the Provincial Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Good afternoon, everyone. Bon après-midi à vous tous. Il n'y a aucun nouveau cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui. Le nombre total de cas jusqu'à présent reste donc à 117 dans la province. Il s'agit d'une bonne nouvelle. Toutefois, nous ne pouvons pas perdre de vue notre objectif. Les efforts que vous avez déployés jusqu'à présent nous ont permis de nous retrouver là où nous en sommes rendus aujourd'hui. Pour ne pas régresser, tous les citoyens du Nouveau-Brunswick doivent continuer à faire preuve de vigilance. Tout le monde doit continuer à rester à la maison autant que possible. There are no new cases of COVID-19 in New Brunswick today. The total number of cases to date remains at 117. This is good news, but we must not lose focus. The efforts that you have made to date have enabled us to get to this place. Staying here will require continued vigilance by all New Brunswickers. Everyone needs to stay home as much as you possibly can. Everyone needs to keep their interactions brief when you do go out. Everyone needs to maintain 2 meters of physical distance from others that they meet. Everyone needs to keep washing their hands regularly and thoroughly, and if you have a facial covering to wear when you go out, that is also preferable to do. These actions are slowing the spread of COVID-19 and building barriers that the virus cannot cross. We need to maintain the barriers to infection that we have built over the last month. We cannot take a break from these actions. They remain very, very, very important in protecting the health of all New Brunswickers. We need to be sure that we know the extent of the COVID-19 spread in the province. We are continuing to test suspected cases, and our microbiology lab at the Georges Dumont Hospital in Moncton conducted 490 tests yesterday. With the wider scope of testing announced earlier this week, I expect we will be continuing to increase the number of tests being done for COVID-19. We need to keep looking. Nous devons savoir avec certitude à quel point le COVID-19 s'est répandu dans la province. Nous continuerons à faire subir des tests aux personnes pour lesquelles une infection est soupçonnée. Notre laboratoire de microbiologie au centre hospitalier Dr. Georges Dumont à Moncton a effectué 490 tests hier. Comme nous avons élargi la portée des tests de dépistage plutôt que le nombre de tests de dépistage de la COVID-19 que nous effectuons continuera à augmenter. Nous devons poursuivre nos recherches de cas. We are very fortunate in New Brunswick to have skilled and dedicated teams of investigators who are doing the meticulous and exacting work of hunting down the virus and mapping its spread through New Brunswick. Our public health teams based in our communities and managed by our regional health authorities are doing a superb job of identifying cases as they emerge and determining how it may have spread. This is called contact tracing, and it's a vital aspect to our effort to slow the spread of COVID-19. We are working closely with my office, the Office of the Chief Medical Officer of Health, the Department of Health, and our public health contact tracers. They are working diligently to slow the progress of this disease. Once a confirmed case is identified, their task is to determine who that patient may have come into contact with and isolate them from the wider population. And again, this is the type of illness that you can spread it to around 3 people. Each case can spread to 3 people in very short time frames. So doing that contact tracing really, really quickly means that anybody that came into close contact with the case would be self-isolating at home very, very quickly, so they would then not spread to others. They must be aggressive and also tactful. Their work requires them to bring news that no household wants to hear, that they may have been in contact with a serious disease, and that they have to be receiving of the direction so that the disease may not be spread further. And I truly admire the work that public health teams are carrying out, and I thank them for their tireless effort. The effectiveness of our contact tracing efforts depend greatly on the cooperation of the public, working with our public health nurses and our regional medical officers of health. And sometimes even some of our public health inspectors have been involved in that contact tracing as well. Should you be contacted by public health during their investigations, it's very important that you follow their directions to the letter. The information that they provide and the detailed work that they do is so precise that it is very, very important to follow all of their directions. J'admire le travail qu'effectuent nos équipes de santé publique et je les remercie pour leurs efforts inlassables. Quand j'ai pris ma poste originalement dans l'année 2014 comme médecin hygiéniste en chef adjointe, j'ai fait un tour du province, j'ai rencontré presque toutes les équipes dans toutes les régies et même dans les autres parties qui sont liées à des régies. Alors, quand je les ai rencontrés, c'est des gens qui travaillent très, très fort, qui sont très passionnés. Alors, ça, c'est quelque chose que, encore, j'admire beaucoup le travail qu'ils font maintenant. Et des fois, on ne se rend pas compte que le travail que la santé publique fait, c'est pour prévenir des cas pour devenir plus, pour augmenter en nombre et aussi pour prévenir plusieurs personnes pour se rendre à l'hôpital avec des maladies, avec des complications de COVID-19 et qui nécessitent l'hospitalisation. Alors, quand eux, ils font leur travail et ils ont la coopération avec les gens du public, travailler ensemble, en collaboration, ça veut dire qu'on peut nous protéger comme une province. L'efficacité de nos efforts en recherche de contact dépend grandement de la collaboration de la population. Si un représentant de santé publique communique avec vous dans le cadre d'une enquête, il est très important que vous suiviez ces consignes au pied de la lettre. If you are directed to self-isolate, that means you should not leave your home. Don't go out to get groceries or medications even once. Please ask a friend or a family member to do that for you. Until it is certain that you are free of infection, please stay in your own home. These efforts are slowing the spread of COVID-19 in New Brunswick. As we know, a person with COVID-19 can spread to 3 people very, very easily and quickly. And in fact, the contact tracers have reported back to me through my epidemiologists and some of my team at the central office that on average, every single case of COVID-19 that has been, that the contact tracing was done on, that they had on average 2.7 close contacts. So that's almost 3. So that means that the average of being able to infect 3 other people quite quickly is there. And so if you did the math, and if there's any kids watching, and I know some kids watch every day with their parents, if you're doing the math and you multiply those numbers, 1 case of COVID, a person with COVID-19 can transmit to 3. So you multiply that by 3, and then those 3 people can transmit to 3 other people, that's 9. Then you take 9 and multiply it by 3, that gives you 27. 27 multiplied by 3 gives you 81. 81 times 3 gives you 243. If you multiply that by 3 again, you're going to get 729. And if you multiply that again by 3, that's 2,187. And that can happen over the course of several weeks. So that is why we cannot stop what we're doing right now. We need to continue the work that we're doing. It is very, very important. So again, a shout out to all those public health nurses and people working with public health and the teams to do that contact tracing. And kudos to the people who are following those instructions, because that is how we are succeeding right now at keeping the case numbers low and keeping people from requiring hospital admission and ICU admission. So, until it is certain that you are free of infection, please stay in your own home when you're following the advice of public health. And these efforts are slowing the spread of COVID-19 in New Brunswick. These efforts are keeping our hospitals from being overwhelmed. And these efforts are protecting the most vulnerable in our society and those who are protecting them. These efforts are saving lives. And I'm going to say it again. These efforts are saving lives and will continue to do so if everybody continues to do their part. I need you to keep doing what you're doing. We need to remain strong and vigilant, and we need to stay safe and help keep everyone safe. Vous devez continuer de faire ce que vous faites présentement. Restez forts et vigilants. Restez en sécurité et aidez les autres à rester en sécurité aussi. Thank you very much. Merci.
Bonjour, good afternoon. Over the last few weeks, we have all been dealing with an extraordinary situation, unlike anything we have ever experienced. Our government has adjusted as quickly as possible to keep New Brunswickers safe. Nous avons continuellement réévalué notre intervention à mesure que de nouveaux renseignements devenaient disponibles et nous continuerons de faire le changement nécessaire. After meeting with all party cabinet committee on COVID-19 and with the cabinet, we are extending the declaration of the emergency under the Emergency Measures Act for another 14 days. We will continue to extend the declaration every 14 days until we reach a point where we are confident that these restrictions are not needed. We've made a few revisions under the emergency order today to help clarify some of these restrictions. For example, we want to be clear that restaurants that offer takeout must ensure that customers waiting for food are maintaining a physical distance of at least 2 meters. We also want to make it clear that property owners must take steps to prevent gatherings on their premises. La plupart des gens de New Brunswick comprennent que c'est une mauvaise idée et se rassembler en ce moment. Bien sûr, il y a des travailleurs essentiels qui doivent être au même endroit pour faire leur travail. Et les familles qui vivent ensemble vont continuer à partager leur domicile. Mais, à ce pas-là, nous continuerons à demander aux gens d'inviter les rassemblements. Please continue to respect the need for public health and avoid getting together with people outside of your household. We've been listening closely to the feedback of New Brunswickers throughout this evolving situation. We've received a number of requests for changes to the emergency order that could make life a little bit easier during these difficult times. There are some requests that we still cannot accommodate because the goal of keeping New Brunswickers safe and healthy must be maintained as our top priority. But after careful consideration and discussions, we are making several changes to help New Brunswick businesses and individuals. Numerous restaurant owners have told us that they are struggling to make their businesses work now that they have been forced to close their dining rooms and are limited to takeout and delivery options only. Maintenant, nous devons faire tout ce que nous pouvons pour soutenir nos entreprises locales afin de s'assurer qu'elles restent ouvertes. At the request of the restaurants that already have a license, during the state of emergency, these restaurants will now be permitted to sell liquor along with meals as part of delivery or takeout orders. Restaurants will still be subject to all of the usual rules and regulations. And of course, they will have to take special care that they do not deliver to minors. Another change introduced to the emergency order today clarifies that gardening and our agricultural businesses are permitted to open. These businesses provide materials used to grow food, and this is an essential service. L'industrie agricole ainsi que les jardins familiaux jouent un rôle important au niveau de notre champ alimentaire. Bien sûr, ces entreprises doivent continuer à s'assurer que les employés et les clients respectent les directives de distanciation physique. Since the pandemic began, I know there has been an issue for some people around paying multiple dispensing fees or co-pays for prescriptions. This is because many people who would typically receive a refill of their prescriptions to last 60 or 90 days are now receiving refills to last only 30 days, leading to more frequent fees than usual. I appreciate the great work our pharmacists are doing to make sure New Brunswickers have the medications they need. At this time, however, we are encouraging all pharmacists to remove the extra dispensing and copay fees associated with the new limits on prescription refills. There are a number of people who live outside the province who own cottages here in New Brunswick. I know they may be anxious to start opening up their summer homes. Flood season is approaching, and I realize that it is a concern for cottage owners as well. I appreciate that these people have chosen to make New Brunswick their second home. But right now, I have to ask them to remain in their primary province of residence. Opening our borders poses too great a risk. Jusqu'à maintenant, nous avons réussi à limiter la propagation du virus. Mais nous devons continuer à opposer ces mesures. C'est le seul moyen d'éviter de voir une flambée de nombre de cas. In the weeks ahead, we will continue to reassess the situation. The good news is that our flood forecast continues to look promising. The situation can change quickly, but right now we are seeing a serious risk of widespread flooding on the immediate horizon is not in the foreseeable future. We are continuing to closely monitor the St. John River, and we will keep you informed if any of the risk levels change. As the weather gets nicer outside, we are all starting to think about summer and what it will look like this year, because it will be different. It may not be a typical summer, but I have hope that it will continue. If we continue to obey the emergency orders now, we may see fewer restrictions in the weeks ahead. We reacted early in the pandemic, and we are starting to see the results, with few cases of COVID-19 over the past week, and none today, as reported by Dr. Russell. Nous ne sommes pas sortis de bois, mais si nous gardons le cap pendant un bois de temps encore, ce sera à notre avantage. Grâce à votre collaboration soutenue, le Nouveau-Brunswick pourra devenir l'une des premières provinces canadiennes à commencer à reprendre ses activités. I know we're all hoping to get back to some resemblance of normalcy in the near future. If we continue to be patient and we're able to monitor very closely over the coming 2 weeks, we're hopeful that commencing in May, we will be able to see some changes in our lifestyles for the better. I thank each and every one of you for being diligent, for following the rules, and protecting your neighbors and your family. And I encourage you to continue to talk to those who aren't able to get out, because that would be many people. Talk to those in nursing homes, call them, connect in some manner so that they too know that we care and that we're there. And I think of all the many people who are guarding our seniors, who are guarding people in the hospital, who are holding strong, because we are making a difference together, and it is encouraging. We will get through this. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Laura Brown, CTV.
Hi, Premier. I'm wondering if you have any updated numbers on how many New Brunswickers have lost their jobs. The last time we heard about kind of a number was Canada, 15,000, I believe, but you had said between 25 and 30 last month. So wondering if you have any updated numbers on the amount of employees that have been affected by this.
I don't think I can give a precise number, but I know we've had about 35,000 that have been processed now in relation to the $900 payout. We had over 65,000 that have applied, so we're working through those and to process all of them. But certainly we know that it's over 30,000, and as I said, we have over 60,000 applicants.
Thank you. Laura, do you have a follow-up question?
Yeah, for Dr. Russell. I'm wondering if 811 is continuing to be busy. You had said that the number has tripled, or the number of calls has tripled. And if you can give an update on how, I believe, 3 people are in the ICU at this time.
I don't like to speak about individual cases, Laura, so I don't want to comment on that for the patients that are hospitalized. For the call volumes, what I am aware of is that the call volumes, when they increased and had that surge, they have like a pop-up group of people that were able to take on that extra capacity for returning phone calls and answering the phone. So as of right now, my understanding is that the capacity is there to, as the demand is, if it stays high, that the capacity is there to meet that demand.
Thank you. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for Dr. Russell. I've spoken to many rural residents who are having or who have had concerning symptoms but don't want to travel sometimes hours to the city to get tested. Are you planning to introduce mobile testing units so that we can give rural New Brunswickers better access to testing?
Well, at this time, the format in terms of being referred to the testing sites is what's in place currently, but obviously this is an evolving issue, so we can always take those things into consideration moving forward.
Thank you. Vicki, do you have a follow-up question?
I do. Thank you. It's also for Dr. Russell. Given that spring break in New Brunswick is a week earlier than many other provinces, there are some community concerns that perhaps New Brunswickers were sick with the virus earlier before testing was opened up. Will we be getting an antibody test, and can people know if they've had the virus already?
So that question has been raised at the national level in terms of what testing technology is out there in the longer term. It won't be available in the shorter term. So in the shorter term, we'll just be able to test for those people who are currently infected with the virus, and usually that can clear from their system between 8 and 10 days after their symptoms start. So that's what we have for right now, but certainly in the longer term, that will be a focus for the future.
Thank you.
Thank you, Vicki. Charles Camiran, TVA, Edmundston.
Oui, ma question s'adresse à Dr. Russell. Les médias auraient rapporté comme quoi il y a un peu plus de 6000 trousses de dépistage qui auraient été livrées au Nouveau-Brunswick qui auraient été contaminées et donc inutilisables. Est-ce que ça peut ralentir le fait de donner plus de tests de dépistage au courant des prochains jours, prochaines semaines?
Non, pas à l'instant. À l'instant, on a assez de stock pour faire tous les dépistages qu'on a besoin maintenant. C'est vraiment Santé Canada qui est responsable pour procurer l'équipement comme ça. Puis eux, ils vont directement avoir le contact avec ceux qui vendent le produit qui est contaminé. Alors, c'est Santé Canada qui va travailler pour trouver une nouvelle stock fur et à mesure que c'est possible de le rendre ici. Mais en attendant, on avait une manière de stériliser si qu'on a besoin. Mais en attendant, on a beaucoup d'écouvillons.
Merci. As-tu un suivi, M. Camiran?
Non, merci.
Merci beaucoup. Elizabeth Fraser.
Hello, my question is for the Premier. When you meet with the Prime Minister and other premiers today, what specifically will you go after or hope to achieve?
So there's a number of topics that are on the table for discussion. We spoke yesterday with the Atlantic premiers about some of the concerns. The fishing industry certainly is one. About the start, we're getting, our processing plants aren't able to start up at this time, and so it's we're basically seeing a request for a delay. Certainly the issues that we have around the agricultural sector, the oversupply we have in the system right now for potatoes and PEI, and New Brunswick share that same concern. The businesses that we're now going through, we're kind of categorizing, the process for early startups and later startups. So we'll be discussing how the funding is going to work there from the federal side. We're looking at certainly the supplies are always on the table, but what provinces need more supplies than others, because we want to be consistent there to help those that in need the most as part of our national strategy. There's we'll be basically looking across the country as and the border securities, what will be the criteria around movement, not only in our economy, but in terms of restriction of movement throughout our provinces, but throughout our nation. And so we certainly have different levels of exposure there in that regard. So, those are just a few of the items that we'll be talking about, but generally every province has a chance, to talk about their particular concerns. And it is a good relationship building exercise as well, because it's very easy after these calls to talk to any one of my colleagues in any province, or the Deputy Minister Freeland, or even the Prime Minister if necessary. We've really opened up a channel of communication.
Thank you. Elizabeth, do you have a follow-up question today?
Yes, I do. Thank you. I have another question for Dr. Russell. On the subject of contact tracing, if someone with COVID-19 has shopped at, say, a grocery store or pharmacy, what steps do your contact tracers take then?
So the contact tracers have very specific information for determining what close contact means. And that would mean that somebody was within 6 feet of somebody for 15 to 30 minutes. So that kind of close contact is usually happening in their homes or other people's homes. So somebody who is in a grocery store or another type of setting like that, that probably wouldn't be considered close contact. And if there was, and they weren't able to track that person down and they were concerned, that type of exposure would be reported publicly with our 2:30 briefings or with a press release. So for close contacts, the contact tracing is always done exactly the same way. The very, very close contacts are immediately contacted. If there was a workplace exposure, an institution exposure, that company or institution will be contacted to let them know that they're at that place of employment or in that institution, that people should self-monitor, because that kind of contact would not be considered necessarily as close unless the person who was diagnosed identified those people as being in very close contact with them, meeting those definitions. And then again, if there's a public exposure, that would be communicated through myself or through a press release so that the public would be aware. Just like when we had some people who were exposed on flights, and also during the measles outbreak when there were people exposed in different settings.
Thank you. Thank you, Ms. Fraser. Matthew Wacomo, L'Acadie Nouvelle.
Bonjour, ma question est pour M. Higgs. On a discuté la semaine dernière de la possibilité de fermer certaines régions pour éviter la contamination d'une région à l'autre au Nouveau-Brunswick. C'était notamment une demande de certaines communautés. Je sais que vous étudiez la question. Est-ce que c'est toujours une possibilité ou est-ce que vous avez définitivement fait un trait là-dessus?
No, I wouldn't say we've crossed out the option, and it is a discussion we've had with Dr. Russell and her team, and looking at, as we start to get closer on a startup situation and what regions, and, talking about where exposures are and how that may vary from one region to another, that it could have an impact more so on our ability to start up businesses and to move into the community to do further testing in order to determine what would work and what wouldn't in that community. But at this stage, we are, still haven't progressed any more in terms of isolating people to move around within our province. We're suggesting to minimize movement, obviously, to stay at home and stay localized. But it's at this stage, we're concerned about our own borders and protecting movement coming and going from outside of our borders, more so than outside of our regions.
As-tu un suivi, M. Wacomo?
Oui, merci pour M. Higgs encore. Je me demandais si on pouvait s'attendre à recevoir une mise à jour économique de la part du gouvernement sur l'état des finances de la province, sur l'état de l'économie du Nouveau-Brunswick. Est-ce que c'est quelque chose sur quoi vous travaillez et est-ce que c'est quelque chose qu'on pourrait voir bientôt?
It is something we're working on, and we've met, we've discussed this, had a discussion. Last night I met with our COVID cabinet. We met today with the regular cabinet, reviewing kind of the economic. We've gone through this with both teams in relation to the current state in the province and what the current projections are. We also reviewed, the number of businesses that have been applying to navigators or getting information that we're directing them either to federal programs or to just help them through this. So the next phase of that is indeed putting together an economic strategy, let's say a 30, 60, 90 day, but it's something that I'll be reviewing with my COVID cabinet colleagues as well as my cabinet in order to kind of lay out a roadmap going forward. So a lot is depending on the next couple of weeks and the 10 days, and we see how the testing goes, because, just as I've said over this last few days, if we are able to maintain the level of cases at certainly where they are at zero or minimal, then we'll need to look at what are the appropriate measures, what are the appropriate businesses can start up, and how can they do it safely, because they also need to be respective of the the public health conditions, which will be with us for some time to come.
Thank you. Merci, M. Wacomo. Andrew Watt, Telegraph Journal.
Thanks, Bruce. My question's for the Premier. Premier, when did you know that these test kits were contaminated? Why didn't you tell New Brunswickers? And can New Brunswickers trust the other test kits that are spread around the province?
So I knew probably a week ago, and we've had supplies come and go, and with if we share from one province to another, in fact we're getting another I think 1,000 or so from Newfoundland right now, because that's part of how we set up between the provinces. If we have a situation that jeopardizes our testing, jeopardizes our supply. But I said here yesterday that, if we had a condition where we were maintaining, let's say, roughly a 2-week supply, then I would always comment about it being an adequate supply. We'll have cases where items will come and go that, once inspected may not meet the standards. Rest assured, if we have a situation on a supply that restricts our ability to do our job and do our tests and protect our citizens, you'll be the first to know, Andrew.
Thank you, Premier. Mr. Watt, do you have a second question?
I do, also for the Premier. Premier, are you going to accept any more PPEs or testing kits from China?
Oh, I think it's possible. I mean, I know the federal government is putting in orders, and they're dispersing equipment around the country. So, yeah, I guess to say that would be ruled out wouldn't be probably the correct statement or conceivable at this time. But the federal government is looking at that, actually looking at sending transport to bring supplies in and then distribute. So, yeah, I would say under the proper scrutiny to ensure that they're safe, they could be dispersed anywhere in the country.
Thank you, Mr. Watt. Silas Brown, Global TV.
Hi, Premier. So, speaking about an economic strategy moving forward, obviously last month when you presented the budget, you had said that the surplus and the money marked for net debt payments could be used for as flexibility, fiscal flexibility, if we were to find ourselves in this pandemic situation. But obviously, the revenue expenditures and revenue collection projections are completely shot at this point. Do you feel that the province has adequate fiscal capacity at this point to help aid in, an economic stimulus package or a fiscal stimulus package to help move the economy along again?
Yes, I do. It is a balancing act, and I mean, we know that there's extensive federal support here as we move forward. But I think it's important to recognize we have to, be strategic about how we bring the economy back, how we get people back in business. I think there's a situation, that we have to look at every case in every region so that we can bring our province back as one. So I feel yes, right now we do, but we're, as you know, and we've used up all of our capacity certainly as a surplus, and debt payment are no longer even an option of any kind. So we are certainly now in very significant deficit territory, and I don't see that changing anytime soon. But we do have to be measured on how we manage this going forward. So I don't know what's going to happen in the coming years with in relation to our transfer payments. I mean, we've lost a major portion of our economic dollars that flowed into Ottawa, and that's through the energy sector. So whether Ottawa will be forced to rationalize transfer payments coming forward or not, I think we have to be prudent, and that's why I'm pleased and excited to be working with the other three leaders, because this is a situation where fighting the disease the virus is one thing, but managing our path forward collectively so that we all recognize the challenges we're facing is extremely important.
Thank you. Mr. Brown, do you have a follow-up?
Yeah, municipalities are across the province are in pretty dire straits when it comes to their budgets, and obviously they are not able to run deficits. is the province able or willing to step in at any point to help bridge some of these shortfalls that municipalities are facing, even as they are looking at trimming staff and trimming expenditures?
So I'm actually on a call tomorrow with the association, the municipalities, so that to get a good first-hand view of what they're experiencing. You know, I think that just as we've had to exercise emergency measures here in relation to our the situation and what changes we had to make, I think we'll have to look at that in relation to the municipalities and their requirements, their ability to borrow money, and their, I guess, their ability to run a deficit. But I think it looks at every municipality on their own. You know, we won't necessarily have the physical capacity to just let everyone do the same thing and try to bring them all back to where they were. So it's going to be a case by case, looking at municipalities and working with them to do the right thing, whether it's changing the borrowing rules or whether it is funding. But it'll be a managed process, and I'm starting that tomorrow with the municipalities meeting.
Thank you, Premier. Thank you, Mr. Brown. Adam Harris, Telegraph-Journal.
Thanks, Bruce. Question for the Premier. Premier, Prime Minister Trudeau announced a new program today to help small businesses cover the cost of commercial rent. But he says to implement it, the feds must work with the provinces because you govern rental relationships. I wanted to know what the role of the province would be in this and what you're looking for in a rent subsidy package.
So I don't really have any details in relation to what the federal government were talking about in this sense. I might get more clarification tonight. I mean, there's been other issues, and I guess certainly the $2,500 limit for the nursing workers is another one to get clarification on how that works. And I'll be asking on this one because it's a new program that they've put out there, and I don't understand if it's all related to the provincial program or related to federal, but I hope to get clarification tonight.
Thank you, Premier. Mr. Harris, do you have a follow-up?
Sure, please. Just on that topic, have you looked at rent subsidies for businesses before? We've heard from a number of businesses that could help. I just wanted to know if that was on the province's radar or if it's something you believe could help businesses.
What we've done, Adam, is look at each case by case, and we've said to businesses we wanted to work with every one of them individually to understand their situation, what's it going to take to get them back to normal as normal as possible. And so I don't I guess add or rule out any options that we may need, because we find that many businesses or different businesses are in different situations. So all of this we try to balance with the revenue that certainly we need to continue to pay for the costs of the services that New Brunswickers continue to use. But I'm open to look at every case, every business, and understand their particular situation and how we can manage through this together.
Thank you, Premier. Thank you, Mr. Harris. Michel Corriveau, Radio-Canada.
Oui, bonjour. Merci, Bruce. C'est une question pour Dr. Russell et aussi pour le Premier ministre, s'il veut y répondre. Les tests en provenance de la Chine, j'aimerais savoir comment vous avez réagi quand vous avez été informé de la situation. Est-ce que c'est normal comme situation?
Michel, peux-tu répéter ta question, s'il vous plaît?
Bien sûr. Donc, c'est en relation avec les tests en provenance de la Chine. J'aimerais savoir quelle a été votre réaction quand vous avez été informé de la situation et est-ce que c'est normal comme situation? C'est une question qui s'adresse à Dr. Russell, mais aussi au Premier ministre, s'il veut y répondre.
Oh, sorry. Sorry, Michelle. I did not hear the original question. I thought it was directed to Dr. Russell. In relation to the original swabs, well, obviously disappointing because there were about 6,000 swabs that were not usable. However, we are looking at, and the Dumont is working with the company for a possibility to have them sterilized and have them available to us. So we have two scenarios here. We're fortunate that, we have adequate supply, so we're not restricted in testing at all. The other is that the federal government, are looking for, we have others on order, so it's to back up in that regard. We do hope we can reuse them because we don't want to throw them away, but the company that's responsible, it looks like it is an issue related to the packaging and the situation around the company. So we're expecting to get a full replacement.
Merci, M. le Premier ministre. Michel, M. Corriveau, as-tu un suivi?
Oui, merci, Bruce. Est-ce que, à votre connaissance, il y a eu d'autres équipements contaminés en provenance de la Chine qui ont été livrés au Nouveau-Brunswick?
So we did not know that. We're doing, I think the federal government, as I'm saying, they are putting a lot of effort now into the quality control. I think initially maybe a lot of things were getting started up in China. Things were getting out maybe before the actual quality control program was as strict as it is. But regardless of the quality control that exists at point of, exit from the originating firm or company or country, we're doing our own quality control here when it arrives. So we're not accepting anything on face value. We're not taking any chances with our equipment or with what we're supplying to the employees and the people that are working in our system.
Thank you. Merci, M. Corriveau. David Coach, Times and Transcript.
Hi there. Yes, just regarding the new policy allowing the delivery of and pickup of alcoholic beverages. The WHO posted a statement yesterday saying that, alcohol consumption can worsen a number of conditions during COVID-19, weaken the immune system, and so on. So I guess the question is for both Dr. Russell and the Premier. How would you respond to critics who might say that alcohol access should actually be curbed, not increased, considering the statement from the WHO, which calls for governments to enforce measures which limits alcohol consumption?
Yeah, so that's a good question. I mean, here in New Brunswick, obviously, we weighed the pros and cons. We took into account information from our colleagues at Mental Health and Addictions. As you know, or you may not know, and some people don't actually, alcohol is probably one of the few drugs that the withdrawal symptoms can be fatal. So there are reasons that we took into account around that and mental health and addictions to continue to be able to have those establishments open. And so, yeah.
Thank you, Doctor. Do you have a follow-up, David?
Can we get any more details about the new policy? Will it allow cocktails, wine, beer? Will there be any particular limits on what can be served?
The program allows for a licensed establishment to deliver what it would normally be selling, obviously in a sealed container and not be sold to minors. So the same rules apply to that establishment as would apply to the delivery. And it's so there's nothing changed in that regard. This actually is not the first time for this in different provinces. There are several provinces that are already doing this. We've had a request, well, more than one, from the Restaurant Association to help their companies, with their bottom line and to make this service available. So we're again trying to work with businesses where we can, to make it easier for them to come back and stay in business. And at the same time, if there's a demand, I guess we'll see that. But obviously, that seems to be the case in other provinces.
Thank you, Premier. Thank you, David. Danielle McCready, CBC.
Hi there. My question is for the Premier. What is the government doing to support artists and musicians who maybe didn't qualify for the emergency benefit? What kind of supports are available to them?
So there is a program that is set up. I can't particularly go through the details, but yes, we have been working with different. They're coming in too through the departments and I believe also through navigators. So we're working with each of these groups because we recognize it's important as well to ensure that they have a continuity and are able to get back to normal as they can. So I can't define the particular program, but I also can't say that it's really, they're saying the same support exists for artists and in the same manner as it exists for others.
Thank you, Premier. Ms. McCready, do you have a follow-up?
Yeah, this one's also for the Premier. Just around the pharmacies and the copay announcement that the changes there. So are you requiring or just asking that pharmacies drop copay fees?
Well, at this point, we're asking. We think that it's a, we don't believe that many who are subject to paying additional fees because the drugs are being rationed. It should be something that they have to pay either through a, the dispensing fee or through a copay. And I know that the health authorities are working with the pharmacies and the association, because the other aspect of this is, some drugs aren't a problem in the case of supply anyway, and we may be able to come to an agreement in that regard to say, well, okay, there's some that are very critical that need the 30-day, and there's others that maybe don't. And the pharmacies may have already looked at this as an option and to ensure, because number one is that we have supply, so we don't run out. But then it's a case of, can we provide a lower cost to many people that need these drugs, many vulnerable people that need them and routinely require them. Not only is it more difficult because they're coming more often to these facilities to get a supply, but it's costing more each time.
Thank you, Premier. Thank you, Ms. McCready. Geneviève Normand, Radio-Canada.
Thanks, Bruce. My question is for the Premier. I'm calling you this afternoon from Shadiac, and there's a lot of people in the summertime who, come into town, and it's one of those places in New Brunswick that relies on tourism. So what do you expect for the tourism season? And do you believe at this point that provincial borders will be open for the months, let's say, of July and August?
I think, and you may want to ask Dr. Russell this as well, but we'll be working together on this situation. But I think to have provincial borders open, as we might have one time, or certain experience in the past, is rather unlikely. Do I think there may be situations where it could be arrangements made? And if you think of PEI situation and ours, it's kind of similar in that sense. Is there an opportunity? And I've already had these discussions. We've had them both with Premier McNeil and with Premier King. But I think this is a summer when New Brunswickers, I'm hoping that we're in a situation where New Brunswickers can discover New Brunswick, and that's what I'm really counting on, that we can get this situation under control, and we can do enough testing, and the comfort level will be high with public health, that we will be able to, with appropriate, distancing measures and appropriate guidelines being followed, be able to have people once again explore our province. But I think the likelihood of having out of the province activities or people moving in through the province, like we would have seen certainly last summer, is not even bears any likelihood of what this summer will look like.
Thank you. Mademoiselle Normand, as-tu un suivi?
Yes, I do. Oui, j'ai un suivi. So again, my question is for you as Premier. Are there any talks at this point about sending health professionals from New Brunswick in provinces that are most hardly affected, like Quebec?
No, don't think so. I just looked to ask Dr. Russell this. No, I have not heard any terms of any individuals actually going. However, there are lots of discussions about sharing ideas, sharing expertise between all the provinces. And I know that certainly applies to public health, but it applies to individual doctors about what they're seeing, what they're treating, and I know there's a lot of conversation going back and forth with different provinces in that regard.
Merci. Voilà la fin de notre mise à jour. Merci beaucoup.
Length of the preceding program, we now join the regularly scheduled program already in progress.
International units per day, and it wound up being something that took down a whole bunch of researchers and everything else because Health Canada was quite upset about the decision. How about keeping chlorine in